tomorrow you make house calls, and even though you stated that there's only one reason to treat patients at home is because they need care, I feel compelled to ask you, why did you start making house calls, and do you ever feel like not no longer doing it?
All right, I'll give you the real answer
Yes.
first,
Mm-hmm.
the practical answer. So when I left that surgical residency program, I needed a job. So there was a group in Brooklyn called Doctors on Call,
Uh-huh.
and they offered me a job. They said, "Oh, we'll give you a job today." So I took the job. At the same time, Kings County offered me a job, so I took that job. I'm Jamaican, so any job I get, I just take. So all of a sudden, I'm doing two jobs, and one of them was a house call job. The other one was a hospital job. Just the place I needed to be. I mean, and then of course, I've subsequently developed my office.
Uh-huh.
So. And again, we talk about faith
Faith, yes.
earlier,
Mhm.
and that's what it is. Where should a doctor treat a patient? You should treat them in the hospital, right? That's where the tools are. That's where the setting. That's the appropriate setting for a patient who requires tertiary care.
Mhm.
Basically somebody who is ill, who no longer can be managed at home or in the office, should be managed in a hospital. But the home is an ideal place to treat many patients. There are patients who can't leave the house easily. Why should you take somebody who is bedbound, wrap them up, and put them on a stretcher and roll them into some doctor's office or some hospital clinic just so that you can do routine care? Isn't it a lot easier for the physician to go to the patient's home, see that person in their environment, make sure that things in that environment is appropriate? So much easier. And of course, in the office. So, I believe in what I refer to as horizontal integration of that patient care. It's across the board. Wherever that patient is, that's where I go. If the patient can make it into my office, fine. I've created what I consider the ideal environment to do that. If the patient ends up in the hospital, because nobody wants to be in the hospital, if the patient goes there, I go there. If the patient can't come out but don't need to be in the hospital, I go to the house. So I treat patients, we show patients we care. We show families we care when we go into the house to heal. And, incidentally, that's where, we talked about medicine. Well, I talked about medicine 100 years ago. That's where we treated patients. Or we treated, our patients. This concept of a doctor's office or a clinic, that's a relatively recent concept. The home was where the doctor went to see the patient. You jump on your horse and buggy right to the house, and you see the patient there. You call me in the morning, expect me at some point as I make the rounds. That's what rounds is all about. It's not just rounds in the hospital, it's rounds to all the different houses. Well, certainly you mentioned telemedicine, which, I think is certainly an opportunity to bring care to places where you don't have enough health resources, enough physicians, and so on. And, and I'm getting to your question. I just want to point out that you saw when I walked in here, I didn't come in with a briefcase with a whole stack of papers. I came in here with a tablet. I came in here with an iPad and a cell phone, and that's my entire world. I can go on that. I can write prescriptions. I can do just about anything that I can do in my office. When I make my house calls, I have the same thing. As a matter of fact, I'll introduce you to a recent article I wrote, a tablet, a stethoscope, and the future of medicine. And and that is pretty much where I see medical records and technology, certainly for me in primary care. And it does, it certainly does come between the patient, but I could show you also that it does enhance the care. So when I'm in the house, in the old days, I never had access to the record. Now I'm in the house, but I have the same access to the record as if I were in the office or in the hospital. When I go to the hospital, I can look at the records in my office from the same iPad, the same instrument. I talk into it, and it starts writing certain parts of my record. So,
what is you believe is the most misconceptions about house calls? or some of the misconceptions people have about house calls?
Well, the 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 misconception. I'm not sure if anyone even. I'm not sure most people understand what it's all about.
Mm-hmm.
However, I could tell you what it's about. First of all, it's not much different from an office visit. The only thing that has changed is the location. You know, you still get your vital signs done, you still get a physical examination, you still get a diagnosis made, and you still get a prescription if you need a prescription, whatever that prescription is. So there, what is different about it is that when I go into a house, I am dealing with not just one person. I am dealing generally with a family.
Mm-hmm.
If the person lives alone and they can't come out, there's usually a caregiver. So there is somebody else there.
Mm-hmm.
Sometimes it's a grandchild, you know, a toddler that's running around. Sometimes it's a cat that's trying to get into your bag. You know, sometimes it's a dog that's trying to get petted. So, you know, these are the different things that occur on a house call. Kids are fascinated. I can't tell you how many times I'm walking on the street to a house call and some kid, as they're being dragged by the parent, the kid turns back and look, oh, mom, look, a doctor, a doctor. They see the black bag. Getting into the house is an interesting process. I love going into the various houses throughout the city. It's an interesting thing to do. I feel safe doing it, despite what. So I think that's a misconception. Oh, how could you go do house calls? Aren't you afraid? No, I'm not afraid. Why should I be afraid? I'm doing a good thing. People appreciate that. So I think that's the misconception. Otherwise, it's the same as if I was seeing a patient in my office.
How does one qualify for a house visit?
Well, if Medicare is going to pay for that house call, then you're required to be homebound. If you're going to pay for it, then all you do is you just call me and I come.
That's it.
Yeah.